When a child needs surgery, attention is naturally focused on the young patient. The medical team, the procedures, and the recovery process all revolve around their well-being. But just outside the OR, in the waiting rooms and hallways, parents face their own silent crisis. They grapple with fear, uncertainty, and a deep sense of vulnerability as they entrust their child's life to the surgical team. The hospital's unfamiliar environment, with its beeping machines and sterile atmosphere, medical jargon, a language of complex terms and diagnoses that can be difficult to understand, and the inherent uncertainty of surgical outcomes can overwhelm them, creating a perfect storm of anxiety and stress. This heightened state of distress isn't just an emotional reaction, it's a real clinical concern that can have significant implications. Parental anxiety isn't just background noise, it's a palpable force in the pediatric surgical setting. It can directly affect the child's stress levels, their perception of the hospital environment, and ultimately, their recovery process. Therefore, supporting parents is not optional. It's not a mere courtesy. It's an absolutely essential component of holistic pediatric care, integral to achieving the best possible outcomes for young patients. Nurses, as the family's main point of contact, often serving as the bridge between the medical team and the parents, play a crucial role in recognizing, assessing, and effectively managing this parental stress. When parents feel genuinely informed, understood, and adequately supported throughout the surgical journey, they're far better equipped to help their child heal, providing the emotional reassurance and practical assistance needed. They are also better prepared to confidently manage their child's care at home, ensuring a smooth transition and continued recovery. By embracing a truly family-centered approach to care, recognizing the needs of both the child and their parents, nurses can transform what is often a frightening and overwhelming experience into one that is guided by compassion, informed by expertise, and ultimately focused on the well-being of the entire family unit. Recognizing parental distress starts with observing parents closely. It's about tuning into their emotional state and understanding the pressures they're under. Look for both subtle and obvious signs that indicate they may be struggling. Sometimes it's a fleeting expression, other times it's a more pronounced behavior. Look for physical cues, such as restlessness, pacing, an inability to sit still, or constant fidgeting. Notice signs of exhaustion, like heavy sighs or drooping shoulders or trembling, which can manifest as shaky hands or a quivering voice. Behavioral changes, like increased irritability, snapping at staff or loved ones, or withdrawal, becoming unusually quiet and isolated. Also, be aware of repeated questions. This can signal underlying anxiety and a need for reassurance. Emotional distress may show as excessive crying, feelings of guilt, or catastrophic thinking, where they jump to the worst possible conclusions. Listen carefully for phrases like, "What if something goes wrong?" or "I can't handle this." High stress can impair concentration and decision-making, making it difficult for them to remember details or weigh options effectively. This makes it hard for parents to process information, even when it's presented clearly. Remember, these signs aren't a lack of interest or concern. They're symptoms of being overwhelmed by a difficult and often frightening situation. Spotting these cues early allows nurses to adjust their communication style, provide tailored information, and offer the right support to help parents cope. Parents' stress often stems from fear of the unknown and loss of control. Handing their child to strangers for surgery is terrifying, especially when they don't understand the process. Poor communication or information overload can heighten anxiety. Waiting for updates is agonizing, while too much technical detail can overwhelm. Disrupted routines, financial strain, and juggling other family responsibilities add to the burden. Pre-existing anxiety, past negative healthcare experiences, or lack of support can intensify distress. Recognizing these stressors helps nurses tailor their support. Proactive, clear communication and empathy are key to easing parental anxiety. Nurses are often the first point of contact and can significantly impact a family's experience. This is achieved through practical, empathetic actions that demonstrate genuine care and understanding. It's about more than just medical expertise, it's about human connection. Start with clear, jargon-free communication. Medical terminology can be overwhelming, so it's important to use language that everyone can understand. Explain what's happening and what to expect in a step-by-step manner. Visual aids like diagrams or timelines can be incredibly helpful. Offer regular updates, even if there's no significant change in the situation. Keeping parents informed, even if there's no new information, can alleviate anxiety and demonstrate that you are attentive to their concerns. Small gestures of kindness can make a big difference. Offering a chair to a tired parent, a bottle of water, or showing them where to find amenities like the cafeteria or restrooms can provide comfort. These small acts help parents feel cared for and supported during a difficult time. Encourage parents to participate in their child's care when possible, within the bounds of medical safety and hospital policy. This restores a sense of control and allows them to feel like they are actively contributing to their child's well-being. Listen actively and validate their feelings. Acknowledge their concerns and let them know that their emotions are valid. Reassure them by saying, "It's normal to feel worried in this situation." Provide clear, written instructions for any follow-up care or medications. Connect them with relevant support resources, such as social workers, support groups, or financial assistance programs. Empowering parents with knowledge and active involvement in their child's care significantly reduces anxiety about the transition home and promotes a smoother recovery. This holistic approach builds trust between the healthcare team and the family. Ultimately, it strengthens the family's ability to confidently support their child's health and well-being. To know if the support works, evaluating its impact is paramount. Informal check-ins, asking parents how they feel, offer immediate feedback. Look for reduced anxiety, more engagement, and fewer signs of distress. Formal surveys after surgery can highlight strengths and areas for improvement. Supported parents report higher satisfaction and help their child recover better. Lower parental anxiety leads to better outcomes for both child and family. Family-centered nursing isn't just compassionate, it's essential for healing and trust.